Namaste and welcome to the Federal. Uh, in our continuing coverage of the COVID-19 coronavirus, today we are joined in live uh, by Professor Ramanan Laxminarayan, who's an affiliate professor of global health and also director and senior fellow of the Center for Disease Dynamics, Economics and Policy. And we hope to be discussing about the emerging situation right now. Thank you very much, Professor Ramanan, for joining in our show. So, how are things in India? We are seeing only two extreme. Either we are seeing absolute panic at one end, and at the other end, we are seeing complete lackadaisical attitude. Where are we as far as the disease is concerned in India?
So, Venkat, we shouldn't be at either of those ends. We should not be lackadaisical and we shouldn't be panicking either. India is in a stage where the government early on, shut the borders both with China as well as with, some other key countries with respect to visa restrictions and flight restrictions. And therefore, we may have bought a week or two with respect to, when the virus has entered India. And so the response there, and also in terms of state governments, enforcing shutdowns has been absolutely, extraordinary. And I think the government has been very responsive. We have probably fallen short on testing because we have only tested to date about 11,000 or 12,000 people for coronavirus. And that probably is why we have such few cases reported, less than 200, when many small countries have, many more cases. And that's because we have used a very narrow testing criterion. And this is something that I hope will change in the days to come. But I think your viewers should see this as something to take very seriously. Please take it very seriously. But panic is not going to help. And, selfish panic where we're just watching out for ourselves, that is definitely not going to help.
Yeah. So, how are things like, people say that the community transmission or stages of the epidemic, where are we in terms of stages of the epidemic? Because last Friday, when the health secretary was specifically asked, have there been any community transmission? The health secretary said, no, there has been no community transmission, and these are essentially imported cases. I'm not, the WHO has, of course, started saying we're having local transmission, but where are we? Are we at a stage where are these social distancing measures and the shutdown measures sufficient, or what else? Are we in the realms of community transmission right now?
So all the evidence from disease models and from other countries suggests that we should be in the community transmission stage, simply because it is very hard to keep a virus as transmissible as coronavirus just within people who came from abroad or their immediate contacts. Because we have only looked for people who are in those two categories, we have not found any case of community transmission, and the small sample that ICMR has done for community transmission checking is simply too small for a country the size of India. So I think there's absence of evidence, but that's not evidence of absence. We don't really know if we have community transmission or not, but from my professional judgment, I would say there probably is community transmission, and not just now. It probably started about a couple of weeks ago already.
So I know this is a general question, but it is how does infectious disease modeling inform strategic and operational response at the local or at the country or the international level? Would you be able to explain?
So infectious disease modeling is important because infectious diseases, by definition, they spread, they're communicable. So if you have someone with just diabetes or hypertension, that's not spreading from one person to the other. But in the case of infectious diseases, they infect. And typically, one person who's infected infects, 1, 2, 3 more other people. When the number of secondary cases, the number of people you're infecting on average is less than, if on average each of us is infecting more than one person, the disease will survive and it will thrive. Now, you take a disease like measles, which if I sneeze here or cough, someone as far away as 20 meters away will get infected. That's a highly infectious disease, and every case will generate 17 to 20 additional infections. In the case of coronavirus, this novel coronavirus, it is pretty transmissible, somewhere between 2 and 3 secondary cases for every primary case. And also, it is a disease where the fatality rate is higher than for other diseases like seasonal influenza. It is not as high as for SARS, but it is about 20 times as high as for influenza. And influenza, probably we have about 100 million cases of influenza a year, and we probably have, about 0.1% or less of people dying because of influenza. So we don't take that so seriously. But if you think of coronavirus as novel one, if 100 million people are infected, then 2 million will die. And that is what makes this a serious situation.
Oh, very true. Now, I mean, as a health economist, how do you view this shutdown, especially in a country like India, on the daily livelihoods and, in general, the effect on economy? And what could government do as policy intervention to help out people affected in this, especially from the vulnerable, marginalized, and the poor community?
See, in India, many people don't have access to healthcare even in the best of times. So at a time like this, they literally have no access to healthcare. There are no facilities in most of the places where poor people live if they are not in an urban area. And you have to remember that 3/4 of our doctors are only in tier one towns. The remainder of the country really does not have much by way of medical facilities or doctors. And primary health centers are mostly unequipped to deal with something of this scale. Certainly, sub-centers are not equipped to deal with something of this scale at all, because you have to remember, if a patient gets admitted into, say a district hospital and then create secondary cases because of transmission, we are putting all those health workers, those hospitals, those doctors all at risk. Which is why I think the right strategy is for immediately for India to create a plan B, which is of creating a large number of temporary hospitals, just like China did, so that we can take any respiratory infection and put them in there. And you have to be proved to be negative for coronavirus before you're put into a regular hospital. That's the only way in which we can get out of this, because social distancing is a luxury for people who can work from home or on a computer. If you're a daily worker, you're working on a factory site, or you have to be a gardener somewhere, whatever it is, there's no social distancing that's possible, because you have to catch public transportation and you have to go to these places. So I think you have to remember that social distancing is a very elite concept. For the rest of the country, uh, it's not clear what we will do. And unlike China, we don't have the ability to lock down a population of 1.4 billion. It is just not, it's not possible. We are not that kind of a country.
Sorry, thank you. Coming to
Are you okay?
I'm perfect. I'm okay. I just got something over here, but yeah, we have been taking a lot of precaution. We keep
Okay.
getting the infrared done, right? So that question would be, probably the last question. I know I should not take too much of your time. What are the role of community involvement, especially things like multidisciplinary working and global cooperation, in terms of this outbreak response?
So I think there are three things really. I mean, first of all, this will be contained only by community cooperation. It cannot be solved by some external party or the government. It will only be community cooperation. My hope is that when testing starts scaling up, that everyone will take that test seriously and self-quarantine for a 2-week period, so that they don't transmit it to their immediate family. In Wuhan, in China, many of the cases were either because of people infecting their own family members, which is starting to happen in India as well, or because of hospital transmission. So it's very important that individuals take care of themselves, and therefore in that way they take care of their community. The second thing is that I think everyone is going to face panic at a very similar time. And there might be people running for cash from the cash machine, or for food and supplies and so forth. So it is very important that we don't respond to this with panic, because that panic itself can cause a lot of damage to us, to our economies, but also to lives. Can you imagine people going hungry because someone with more money has gone and cleaned out the shelves? So I think we have to watch out for each other, make sure that we are planning in a way that starts right now, but don't panic at the last minute. Please start planning right now. Think about people around you. Think about what you're going to do with your maid, or if you happen to have one, or if you have a driver. What is your solution for them? Either if they become infected or the number of infections going around are too high. Please think of everyone around you and make a plan that works for everyone, so that you keep yourself safe, but it's not just about you and your family, it's really about your community as well.
Oh, I think that's a fantastic thing. Thank you very much. And as you rightly said, I'm sure with personal responsibility and the state alacrity, I think we could be able to solve this problem together. Uh, Thank you so much, Professor Ramanan, for having joined us. Indeed, a pleasure to have connected up with you on this. Thank you.
My pleasure. Thanks for having me, Mikhail.